Well, we as a company, or corporations in general, are really held more accountable on global health than almost any other entity, including a government or an NGO or an organization that's an arm of, say, the United Nations. The reason I say we are held more accountable is because we are graded on our performance every day. And you may say, well, how is a company graded every day on health? It's passively, it's not actively, but if our workforce is not healthy, our production goes down, our revenues go down, and our stock goes down. And Wall Street grades us every day. And in the areas where we operate, such as the Democratic Republic of the Congo, in Papua, Indonesia, Chile, Peru, the leading cause of absenteeism in the workforce are health reasons. Certainly malaria in the Congo, malaria in Indonesia. So if we don't, as a company, address these issues, then we will, as a company, not be as efficient, as effective, and as profitable. And therefore, we're judged harshly on Wall Street. Well, we define forward by starting at the beginning. I will use the example of our project in the Democratic Republic of the Congo. Before we did anything in the health and public health arena, we had a baseline health survey done to determine what the status of health and public health and medical services were when we arrived. We found some interesting things. 8% of the population were aware that mosquitoes cause malaria. 92% of the population did not. So it wouldn't do any good to go in and put up mosquito nets and tell persons we needed to spray their dwellings because they didn't see the need. We found out that there was a poor understanding of why cholera occurred. So one might think that a company, when you speak of global health, needs to go in and address medical facilities, clinics, vaccinations. Well, to be quite candid, they were not living long enough to need vaccinations or medical facilities. What they needed was sanitation, clean water. So in the Congo, the first thing we did was build 1,000 latrines, put in 84 deep water wells, and within 18 months there was no more cholera. Diarrheal diseases were the leading cause of death in the community, malaria next. We have the first professionally conceptualized, organized, implemented, and showing positive results malaria control program ever in the history of the Congo, Zaire, the Democratic Republic of the Congo, whatever name you want to give the country. Now we're looking at putting in facilities. So the way forward is to build a strong foundation that can support subsequent improvements. It does no good to go into a country where there's nowhere to go to the bathroom, there's no clean water to drink, and everybody's getting malaria, and build them an operating theater. There's a time and place for that. Going forward to Freeport is going forward in a logical, practical, systematic, and organized fashion. We have a long ways to go, but we feel that we are building going forward on a very sound foundation. Well, besides this poor sanitary conditions, the % disease entity, infectious disease entity, was malaria. And we found that 78% of the community either had malaria actively or had recently had malaria. So of all the disease entities, once we put in clean water and sanitation, it was responsible for more mortality and morbidity in the community. And as you know, malaria is probably responsible for more deaths worldwide than any other single disease entity. We had experience in Indonesia, Papua, Indonesia, where we created a malaria-free zone in a jungle environment where malaria was endemic. So we brought that expertise to the Congo. And as a result, as I said earlier, we've reduced malaria prevalence in the community by 46%. We've reduced the incidence of malaria among our workforce by 66%. And we're just beginning. We feel this is a good start, but we still need to improve compliance with using bed nets, compliance with personal protection, compliance with drainage. We are working right now in developing a better wall surface for houses so that the indoor residual spray is more effective for a longer period of time. But as you know from the Global Business Coalition on HIV, AIDS, tuberculosis, and malaria, malaria is a key disease problem worldwide. And it does constitute a lot of morbidity and mortality. And among adults, it was the leading cause of absenteeism from work in the Democratic Republic of the Congo at our project. So therefore, it was logical that we would address malaria pretty quickly. I'm a physician, a medical doctor, a practicing cardiac surgeon for 30 years, and I share the philosophy of the founder and chairman of Freeport-McMoRan Companies, Jim Bob Moffitt. And that is that whenever we go into a community, it should be a win-win, a win for us and a win for the community. We just don't go in and extract and pay taxes and leave. We remember that we have a responsibility to be a good corporate citizen. And we also remember that we are guests in these countries, and we need to act like guests and not act like corporate barons who are insensitive to the health needs of communities. And that is part of our corporate culture. As Richard Ackerson said, our CEO, that's part of our DNA. And that's just part of doing the right thing. I think the results that you are able to obtain by getting together various interests with a common goal makes a difference.